Welcome, dear parents, to yet another episode of Paediatric Puzzles. I am Dr. Vivek Vishwanathan, your friendly pediatric urologist, and today's episode is entitled Belly Button Blues Demystifying Umbilical Hernias in Children. Today's topic might sound familiar to most, the umbilical hernia, that unexpected bump near your child's belly button. But fear not, parents, let us together unravel this mystery. Let's start from the very beginning. What exactly is an umbilical hernia? Well, the umbilicus, also commonly known as the belly button, forms when the umbilical cord detaches after birth. Well, ideally, the muscles surrounding this opening close completely. But sometimes a small little gap remains. Now, this allows a bit of the intestine to push through, creating a bulge. Well, that's an umbilical hernia. Interesting, isn't it? Well, you might wonder, are there any telltale signs for us parents to watch out for? Well, absolutely there are. The most common one is a visible bulge near the belly button. It might become more prominent when your child cries, coughs, strains, sometimes even when he laughs. But now, remember that these hernias rarely cause pain, and a painful hernia might actually be telling you that it's a surgical emergency. But how can you as parents be certain that it's a hernia only and not something else? Well, that's where I and some of my colleagues as a pediatric urologist come in. During a physical exam, we gently feel the area. If the bulge disappears when your child relaxes, it's likely an umbilical hernia. In some cases, we might also use a painless ultrasound for a clearer picture. So let's explore the treatment options. The good news, my dear parents, is that most umbilical hernias close on their own by age 4 or 5. As always, there are exceptions to the rule, like the naughty kid in class. If that hernia is large, it's causing discomfort, or it hasn't closed by age 4 or 5, then surgery becomes a consideration. I do know surgery sounds scary for parents, but I'll tell you what exactly we are talking about. As pediatric urologists, we specialize in minimally invasive procedures. For umbilical hernia, typically we perform laparoscopic surgery. This involves tiny incisions smaller than a centimeter in length, a camera to guide us, and specialized instruments to put the intestine back in and repair the muscle gap. Now that does sound much better, doesn't it? Well, you might wonder what exactly would the recovery time be like. Well, recovery is usually quite quick. Most children go home the same day and can resume normal activities within the next couple of days. Now, you might wonder, are there situations wherein surgery might be necessary even if the hernia is small? Well, that's a very pertinent question. If the hernia traps a part of the intestine, which is also referred to as incarceration, it might lead to pain, redness, or vomiting. Then surgery becomes of utmost importance to prevent complications. Additionally, if the hernia contains a structure other than the intestine, like a piece of fatty tissue, surgery might be recommended because the hernia might not reduce. Now, for final words of advice, my dear parents, don't panic. Umbilical hernias are quite common. Most resolve without intervention. However, if you do notice a persistent bulge, especially if it's accompanied by discomfort, do consult your friendly pediatric urologist. Early detection ensures the best outcome for your child. Take care, my dear parents. Stay curious and do join me on my next podcast episode of Pediatric Puzzles. Peace out.